Welcome to Spotlight on the Tuckahoe-Eastchester Lions Club. I'm Lion Frank Cuomo. Today our guest is Renee Levesque, the Administrative Director of Lawrence Community Services. As some people know, the Lions are a service organization. We've been in the Eastchester community for 88 years. We provide service to the community as well as make a significant amount of contributions to local organizations, and the Jansen Hospice is one organization that Renee is going to give us some information on. Is one of the organizations we've been donating for many years to. So Renee, welcome.
Thank you.
And give us a little rundown of Lawrence Community Services and how the Jansen Hospice fits into that.
I'd be happy to. Lawrence Community Health Services is now part of Lawrence Hospital Center, and we have been since about 1998. Prior to that, we started as Home Nursing Association 80 years ago, so not 88, I apologize. And when we originally started, it was actually the Visiting Nurse Service of Eastchester. We're currently Lawrence Home Care of Westchester. We're having our 80th anniversary this year. And it was probably about 1981 that we had a community resident, Bissy Jansen, who lived in Bronxville, who had young children at home, and her husband was 51, and he was diagnosed Thanksgiving of '79 with throat cancer. And she wanted to keep him home. She wanted to provide services for him at home, and there was no formalized hospice service in the community at that time. Bissy coordinated all of it for her husband. She learned how to do tracheostomy care for him. She learned how to get any supplies and equipment, a hospital bed, trach supplies for him at home, take care of him, including a barber to come in and cut his hair. And she did just an awesome job with it. Unfortunately, Alan Jansen died in about 15 months later in January of '81. And right after that, all of a sudden, neighbors started coming up and asking Bissy how they could take care of their loved one. They were in similar circumstances, and she started helping them to the point where she went to the Bronxville Junior League in probably October of that year, October of '81, to talk about starting a hospice and could they look at a community hospice. And they formed a council, and it was through the efforts of this wonderful woman and her committee and the Bronxville Junior League that provided seed money that they went to home nursing at the time as a sponsoring parent, and they started Jansen Memorial Hospice. It opened its doors, took the first patients in January of 1984, and has been growing since.
Okay, that's very good. What services does Jansen provide, and approximately how many patients do you care for each year?
Terrific. Last year we serviced over 520 patients, and we provided them with 25,000 patient days of care at home in the community where they live. There are some we provide hospice in their home. If they live in nursing homes, that is their home. We provide it there as well, and we also provide hospitalized care to them. Basically, the services covered under Jansen are the hospice services that include skilled nursing, social work services, chaplain services, as well as home health aid services. If they need therapies, we do have physical therapy, speech, and occupational therapy available as well. And the cornerstone is our volunteer program. We provide friendly visitors, 11th hour visitors. We provide complimentary medicine that is all supported by our Jansen Fund Board and our volunteers. And that includes our complimentary care is not under the hospice benefit, it is in addition. And that includes music, massage, pet, acupuncture, all of the different therapies that are not traditional medical or traditional under the hospice benefit. And it is provided in their homes.
What is the importance of hospice care to a patient and the patient's family?
The biggest thing is we don't provide curative care, but we are going to keep you comfortable and keep your symptoms controlled and keep you pain-free as long as we possibly can. And we have had many hospice graduates who come on our program. To come on, they have to have an illness that is considered terminal, that there has to be a reasonable expectation from their private physician and our medical director that they have 6 months or less on a diagnosis to live. We have many who do really well, they get more comfortable, they get over that hump of feeling terrible, they start gaining weight, and we can't justify that they continue to be terminal. So we graduate them off hospice, and frequently we move them onto our Lawrence home care and provide skilled care for them there until, if they need hospice again, we move them back over.
Let me ask you this, in terms of who refers people to you? Do they contact you directly, or are doctors or hospitals refer people to you? Is that how it works?
Absolutely, anybody. Anybody can pick up the phone and call us and ask for help. If we cannot help you, we will try to get you to someone who can. Physicians' offices, hospitals, social workers, all refer to us. We take referrals from all of them. Nursing homes, social workers at nursing homes, and families who have heard about us do refer.
What is your scope of area that you cover? Is it basically local, or is it go throughout the county?
We can provide care to patients in Westchester and in the Bronx. Most of our patients are clustered in Westchester, right around 287 and down, and in the northern area of the Bronx. And part of the reason for that is that we provide care 24 hours a day. If there is an emergency, or you need a nurse after hours, we want our nurses to be able to get to you. We have a set staff that covers after hours, but we want them to be able to get to those families relatively quickly.
When you say 24 hours, you're really talking about home care 24 hours. If a person's in a nursing home or a hospital, you really don't. Do you spend 24 hours with them in that environment?
We do not. We do not. We remain available to them, and we do get calls through the night. And actually, this weekend we had a patient in a nursing home who had problems, and we did have a nurse go out late Saturday night to see them and to walk the staff through and get some different medications to make the patient comfortable. And then we had the patient seen over the weekend as well. The hospital, we will provide service for patients in hospitals, our nursing, our social workers, our chaplain, aid service to give the families a break sometimes. What we will do that is the cornerstone of our volunteers is the 11th hour visitors. They will support the family, and they will stay there as long as need be. And many times, families can't stay overnight. They don't want to be there, but they want someone with their loved ones. And we will have volunteers go and sit with the patient and then continue through the night.
How many volunteers do you have?
We have a lot. We just had a luncheon with our volunteers last week, and there were about 45 there. I believe all told we have about 80 on the books, and about 45 very active ones.
Are they mostly from the Eastchester community? Or?
They're from all over.
All over.
Primarily Bronxville, Tuckahoe-Eastchester, Yonkers, Mount Vernon. That is the main cluster you're going to see with our volunteers, but they're all over the surrounding areas.
Okay. What differentiates Jensen from other hospice agencies?
Okay. Good question. The Medicare benefit is the Medicare benefit. It is the same across the country. And any patient who is appropriate for hospice and who goes on hospice will have nursing, they will have social work service, they will have pastoral care, they will have a degree of aid service, they will have that piece of it. They will have, the families will have a 13-month bereavement program after the patient dies that we continue following. What makes Janssen different are our volunteers. Our volunteer fund board raises money for Janssen, and of the amounts that they raise, we provide services to patients and families that is not part of the benefit that they wouldn't have, such as extended hour aid service for patients who can't afford it and can't afford to privately hire, want to stay home. The Janssen Fund Board has supported a program where we can give them more. We have an application that they complete, and we work with them. We have 11th hour aid service where the family wants to stay home. They want to leave the loved one at home. They need either inpatient or they need continuous care around the clock of an aid. The Fund Board will support additional aid service. They pay for all of our complimentary visits. Massage therapy, acupuncture, art therapy with some of the families who have children who need that to work through. Certainly the extended hour aid service, music therapy. Many of our patients who have Alzheimer's or dementia respond really, really well to the music, and it really helps calm them. So it depends on what the hospice team puts together for their plan of care in our interdisciplinary team, and they determine what complementary visits the family would do best with.
Now, this term is generally up to 6 months, right? I mean, if you,
Yes.
You mentioned before that a person had to be essentially told that they have 6 months or less to live. So if the service that you provide and that Medicare pays for, is it generally up to 6 months? Is that how it works?
Actually, it can continue. At
Okay.
6 months, our medical director makes what Medicare calls a face-to-face visit. Visits the patient in their home and says, you continue to be appropriate, and I can recertify you because of this, this, and this. You've lost weight. We've managed your pain, but you've had some infections. They look at all things as part of it, and he looks at the entire person as a whole. And if he can recertify the patient, we can continue providing care. And our medical director will make a home visit at 180 days at that 6-month time, and then every 60 days thereafter. So we do have patients who are on for more than the 6 month.
That's interesting. And it's
Appropriate.
very appropriate, absolutely correct.
Absolutely.
Right. Now, tell us a little bit about how Janssen is connected to Lawrence Community Health Services, because you have a couple of different organizations under that umbrella.
We do. We do. As I mentioned, Janssen started as part of Lawrence Home Care, or what is now Lawrence Home Care. And Janssen will have its 30th anniversary next year. We started in '84, so we've really gone strong, and they've expanded and done a great job. What I wanted to mention also was the Janssen Fund Board also supported the start of palliative care service at Lawrence Hospital back in 2005. And that continues to grow, and that we get many referrals from the palliative care nurse practitioners and the medical director over at Lawrence Hospital of patients that are either in the hospital and need hospice or come out. What we look at doing is when our patients are no longer appropriate, when they aren't terminal anymore and they need care, we transfer them back to Lawrence Home Care. It's the same phone number. Many times we use the same aides, so they don't feel the loss of it as much. Most times we use the same social workers if they need so. The nurses, we alternate, because our home care nurses, we have many home care nurses, as well as Janssen has its own staff of hospice nurses, and the two really are pretty busy. When patients come onto Janssen Hospice, again, home care is a feeder for Janssen Hospice. If patients are on home care and the nurse feels that they would benefit more by hospice and they can get more service from hospice, they'll talk to the patient, they'll talk to the families, they'll talk to the physician, and frequently we'll move them over onto hospice. Okay.
Let me just see if I understand home care. Home care is a service that you provide whereby you put a nurse or not necessarily a nurse, a person in the person who needs that service, and they stay there 24 hours or 12 hours. It's like, is that?
No.
No, it's not that. Okay.
No, you're thinking of private duty home care.
Yeah, I'm thinking.
Or the Medicaid personal care,
Right.
where it's an aid. Lawrence Home Care is a certified home health agency. We can provide skilled intermittent care for a brief period of time.
Okay.
It's during an acute phase for a patient to try to get them better and more stable at home. If they've had an operation, if they've broken a hip, if they have a new joint replacement, if they have a wound, something that's going on, if they have a new diagnosis or new medications. We take referrals from physicians' offices, from the hospital, from the community, from the Department of Social Service, personal care, wherever they're coming
Okay.
from.
All right.
Home care provides skilled intermittent nursing, physical therapy, occupational therapy, speech, and bath aids. The home health aides or bath aides, they usually are just there for personal care under Medicare and insurances Medicare will not pay for more than that, and it's usually capped just for that bath.
And is there a time frame that they have a cap on that for? Is that
It's usually about an hour to an hour and a half, a couple of times a week.
And for how long is that?
It depends, as long as they require skilled services.
I see.
Once there is no longer a skill, home care cannot continue. That's why when we look at patients, if they're going downhill or if we feel that they've gotten to the point where they are terminal, hospice can provide, and does, 4 hours a day of aid service. We have the fund board supported programs that any donation, the Lions Club and any community donation, goes into that fund. It is allocated for our patient care. And this year, our fund board committed $225,000 for those programs. So we do track it and we do provide the service. The other thing that we started actually in 1995, and again, it was Bissy Jansen and it was the Bronxville Junior League, realized that the bereavement program of hospice was only 13 months. And families, especially families with young children, needed more intense bereavement programs. And they started the Bereavement Center of Westchester with the Cornerstone Treehouse program specifically for young children. And it now is an open-ended model. There is a Treehouse program that runs from September through the end of May, the beginning of June in Bronxville and also in Mount Kisco. We just had the closing ceremony 2 days ago in Bronxville, and there were 39 families and about 75 children attending. So it's a tremendous amount.
And as far as the bereavement program goes, what kind of people are involved in that program?
The Bereavement Center has 1.5 paid staff, and all the rest are volunteers. They are trained volunteers, just as the Jansen volunteers are all trained volunteers. The Bereavement Center is different in that there is no billable source.
Right.
Home care and hospice have Medicare reimbursement and insurance reimbursement. The Bereavement Center does not. Every year, they raise 100% of their budget. Their fund board does. Each organization has its own fund board.
How do you get referrals on the bereavement center? Where do they come from?
They come from anywhere in the community. A lot of them come from schools. A lot of them, if they've had a sudden death at a school, if a beloved teacher dies, if someone loses a child, if guidance knows about it, if the hospitals have any issues where they've lost a child or they've got a perinatal loss, they will refer over to the Bereavement Center.
How would since this is going to be shown on throughout the town of Eastchester, how would people who might have an interest in some of your services get in touch with you?
You can dial our number. It's 961-2818. That gets you into Lawrence Community Health Services, and it is the same number for all three programs. Any of us will help you. Again, that's 961-2818, or on our websites. There is one for each organization. Jansen is jansenhospice.org. Bereavement Center is the bereavementcenter.org, and Lawrence Home Care is lawrencehomecareofwestchester.org.
Renee, you've done a good job of telling your story. I hope the people in Eastchester have learned a lot more about your organization and hopefully take advantage of it.
Well, thank you.
And I want to thank you for coming. We've been giving, the Tuckahoe-Eastchester Lions Club has been giving to Jansen Hospice for many, many years. And we think it's a worthy organization and we'll continue. In fact, on our donation list of this year, we got another donation, I believe, of $1,000. So we support you, and it's a great organization, very well managed, by the way. And thank you for coming.
Thank you very much for having me, and thank you all for your donations and for what you do for our patients. That's what makes the difference with Jansen and all of our volunteers, so thank you.
Okay.
While lions are notorious for their voracious appetites, they spend a great deal of time feeding other creatures. In fact, lions will take great care to ensure there's plenty to go around. As you can see, they keep giving with utter ferocity. Bravo, lions, and bon appetit. Do good, be a lion.
I'd like to talk a little bit about a lion who passed away last month. I'm referring to Nick Falco. Nick was a Tuckahoe resident and was a lion for 30 years in our club. He held every major office, was a very active member, did a lot of great things for the club. Very significant thing he did was he built us a food wagon. Nick was in the welding and boiler repair business, and he built a food wagon for us going back about 20 years ago, and we used that wagon to generate thousands of dollars of fundraising activities when we were at Tuckahoe Day and when we used to run a large flea market in town. We sold a lot of food out of that wagon, and not only did he build it, but he maintained it, transported it, and paid the insurance on it at his own expense. For those who knew Nick, you know he was a very generous man. He was a very successful businessman who operated many businesses. He was an entrepreneur. He owned residential real estate property. He owned food stores. He owned video stores. Really a titan when it came to business activities in the Westchester area. Nick achieved the two highest honors that a lion can have, and that is the Melvin Jones Fellowship Award for his service. And he received it 2 times. And we really are going to miss Nick. He was an idol to many of us because of his hard work and his guidance. And being a member for 30 years, he had a lot of influence on the club. So Nick, rest in peace. We certainly are going to miss you.
Did you know volunteering can be fun? Community service is for everyone. Young people, families, men, women. As a volunteer, you'll help your community and gain valuable skills. Network with others. Energize your life. Make an impact and have fun. Get in step with your community. Volunteer. Visit www.lionsclubs.org.